Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter P. Today I'm going to talk about another condition which is called pericarditis. It is, first of all, it can occur in all the, particularly middle age and older people. Usually if it occurs in young people, it probably is viral infection, but usually occurred with another systemic diseases cause the inflammation of this pericardium. Let me just bring up the emergency situation. Is there any situation associated with this pericarditis involved in the emergency visit? I think because of this pericarditis is the inflammation of the wrapping structure on the heart, the two layers of it, the internal layer and the outer layer. So the inflammation of this pericardium will cause the frictions. So the heart, when the heart is, usually there is a fluid inside, but when the pericarditis causes fibrosis and lost the lubrication, so then if that's the case, will impair the heart function, particularly the arrhythmia. So if that's the case, you need to see the emergency. And also impaired the blood filling, limited the dilation, particularly the dilation phase. So if that's the case, you really need to see your physician. It depends on the causes and depends on the progress of the disease. And of course, you cannot manage the home. So this is about the prioritize into the situation that whether you need to see emergency or whether you can manage at home. And on top of that, let me just explain the heart structure before I talk about the pericarditis. So the heart has actually is the endocardium, myocardium, and the pericardium. So the endocardium is the lining tissue inside of the cavity of the heart, the chambers. And also the myocardium is that the really contractile structure to pump the blood, to make the heart contraction, and also dilation to fill the chamber, and also to pump the blood out to perfuse the organ. And the pericardium is the two layers of tissue, like I mentioned, outside of the heart myocardium. In between these two layers, there is some little subtle fluid serving as lubrication and to give enough space when the heart dilates, between dilation and contraction. So that's the structure of this, basically where this pericardium refer to the outer layer of the heart. So in terms of the cause of this pericarditis, it depends. For the young people, it could happen. And if it is acute phase, usually it's really, it's called idiopathic, which means unknown reason, but have this chest pain and may or may not have fever. Actually, this, in terms of idiopathic, probably the cause for the young people without existing precondition, without any medical problems, this idiopathic pericarditis is probably caused by the viral. Usually it occurred after the upper respiratory tract infection, and they have this chest pain, feel tired, and also the heart probably beating in a funny way. So if that's the case, you really need to see your doctor. And the chest pain is associated with breathing, actually, or positional, either when you lean forward or when you sometimes depends on the location of this pericarditis, either lean forward or laying back. So that is the typical presentation of this chest pain caused by the pericarditis. In terms of the other causes, etiology, systemic diseases, for example, the autoimmune disease is the rheumatoid arthritis or lupus. Those systemic diseases might have the inflammation of this pericarditis. Basically, it's the inflammation process, and the symptom is similar, but probably is not that acute, or probably not associated with fever, but just the chest pain with positional chest pain. So if that's the case, even though it's not emergency, but you need to get your physician involved, talk to your physician, you will be brought to the office and to check the EKG, and will diagnose in a special pattern of the EKG, the T wave, and also the emergency situation is if this pericarditis, particularly if it is associated with systemic disease, might have the fluid. Actually, if the fluid is too much, that limit the heart to dilate, to fill the chamber, and limit the blood volume to perfuse the organ. So that's also is kind of urgent situation. The diagnosis is quite straightforward, based on your history, based on your past medical history, based on the examination. The physician will listen to your heart. The special friction sound can be heard sometimes, or the heart sound probably feel like hear from distance, because the fluid in between the heart and the stethoscope. Of course, the EKG is another key diagnosis measure to check the EKG, the special pattern of EKG. So this is about the pericarditis. And in terms of the treatment, is if it's a viral or idiopathic, supportive, monitor, make sure there's no the fluid accumulated between these two layers of pericardium is not too much. So if that's the case, you need to do the aspiration, which is kind of scary. You put the needle in and to dry the fluid out. And if it is a systemic disease, again, if there's a fluid, if the fluid is too much, really limit the heart dilation, limit the chamber ventricle refilling. So that is the indication for the procedure. So this is a paracentesis. It's just put a needle and then draw the fluid out. Other than that, if there's idiopathic, the fluid is not that much, then just the supportive management and monitor closely. If it's caused by the systemic disease, of course, anti-inflammatory treatment. And also actually anti-inflammatory, for example, NSAIDs probably apply in both situations, either idiopathic or systemic inflammation disease. So this is about the pericarditis. In terms of the prognosis, for those idiopathic, probably it's quite, may take a couple weeks or may take a while to recover, but it's pretty optimal actually. And unless for systemic disease caused pericarditis, really need to treat the systemic disease at the same time to treat the pericarditis. So this is about the pericarditis. The taking home message for this video is, if you have, for young healthy people, if you had upper respiratory, if you had the upper respiratory tract infection, a couple of weeks later you feel this chest pain associated with this breathing, if that's the case, or associated with changing position, see your physician. For those who had a pre-existing condition like a kidney disease or autoimmune disease or inflammatory disease like heart arthritis, lupus, or chronic kidney disease, have this kind of similar symptom, chest pain associated with breathing, associated with a changing position, and talk to your physician. Because chronic kidney disease also can cause this pericarditis. So that is the video for today, and I hope it helps. Thank you for watching. I will see you next time.